If you get injured all the time, you probably want to know, why do I keep getting injured all the time? Well, I'm Dr. Anthony Davis, and I'm going to tell you a few reasons why people think they keep getting injured all the time. And then I'm going to tell you the real reason you're probably getting injured all the time. At least this is what I've seen in my clinical experience. The first reason that people think they get injured all the time is form. A lot of people assume that if they lift heavy weight or if they do a particular exercise, they perform yoga poses, whatever it is, whatever kind of exercise you like to do, but if they do it with bad form, then their body is like the Leaning Tower of Pisa or like a Jenga tower, and it's gonna fall apart at any time. Well, form does matter to some degree, and it probably matters a lot more if we're doing really intense exercise or lifting very heavy weight. But when we actually research bad form and exercise, such as rounding your back with a deadlift or other types of bad form, or does your head go too far forward? Are your shoulders rounded too far forward? Do your pelvis tuck forward or backward? We see very, very weak correlations between posture / alignment and pain and injury. So there is some relationship between form and pain and injury, but it's a very, very small correlation. So maybe for some people, sometimes they might get injured, they might have pain that is related to a particular posture or a biomechanical deviation of some kind. But generally speaking, it's probably not the first thing that you should be blaming for injuries. So when people in clinic tell me, when patients are saying, when I lift, I round my back, and that's why I keep having back pain. Usually there's a much simpler and more easily controllable explanation as to why they keep getting injured. I'll get to that at the end of the video. So does form keep injuring you? Probably not. Maybe for some people, but most of the time, probably don't blame your alignment and exercise technique first. The next thing people tend to blame for why they keep getting injured is that they're doing the wrong exercises, or they're doing something that is unsafe. Maybe you've got knee pain and you're blaming running. Oh, I can't run. The impact from running is bad for my knees. That's why I keep getting injured. Or maybe you have back pain and you keep getting injured and you're saying, well, of course I keep getting injured. I keep doing deadlifts. Therefore, deadlifts are bad. Every time I try to start deadlifting again, I throw out my back. Well, guess what? Deadlifts are actually very safe and really good for your spine. Actually, we have pretty cool research where we look at deadlifts and how they actually make your discs, your spinal discs, thicker, so more hydrated. So it's actually really good for your spine. And guess what? Running is good for your knees. We have other studies looking at running and osteoarthritis, and we see that people who run more have less arthritis. So running is not bad for your knees. Deadlifting is not bad for your back. Bench pressing is not bad for your shoulders. Lateral raises are not bad for shoulder impingement, although you could modify for a short period of time if you're in pain, and then gradually reintroduce the lateral raises or whatever exercise if they're causing you trouble. So are bad exercises or unsafe exercises causing your recurring injury? No, stop it. Stop listening to Instagram. Now, I will say a caveat to that is that there are a lot of exercises that I've seen people doing that are just totally absurd. They're like swinging things while they're balancing on stuff, and they're just doing stupid stuff. So I'm assuming that you're a reasonable person, right? Are you a reasonable person? Are you doing reasonable exercises like running and squatting and maybe lifting some weights, but doing generally normal things? Then your exercises are fine. Don't blame your exercises. But if you're going completely off the rails, doing totally insane stuff, then yeah, maybe that's causing your recurring injuries. Use a little common sense, right? The third reason that people tend to think they keep getting injured is because they have a bad knee or a bad back or a bad shoulder. Holy crap, that sucks to be you. It sucks to live in a state of perpetual fear where you're just looking at your own body and you just have this viewpoint of your body like your body sucks. Your attitude sucks. That's what sucks. Your body is fine. Your body is amazing. How amazing is the human body? And you're just taking a dump all over it by saying it's bad because you've had some pain for a while? Please, please, please be grateful for your body. The human body is incredibly resilient. You do not have a bad knee, a bad back. Trust me, okay? Yes, sometimes people have some really serious stuff going on, but most people, if they've had like an MRI or an X-ray or something like that, and their doctor has told them, oh my God, you've got degenerative joint disease. All that is a little bit of dehydration in your joints. It's really not a big deal. Even things like meniscal tears or labral tears or rotator cuff tears or disc herniations, all of these things, if you took an MRI of 3,110 people, because I'm specifically referencing a study by Bryn Kinsey in I think 2015, you take an MRI of 3,000 people and you say, now these people have no pain, these people have zero pain. If you look, you would think, oh, they have no pain, therefore they must have perfect looking spines on an MRI. Wrong! They have spines that look like everybody else's spine. They have disc herniations, disc protrusions, osteoarthritis, which, by the way, we call that degenerative disc disease. Holy crap, what a scary name. It sounds really scary, but it's actually not a big deal. It's just dehydration of the discs, which, by the way, you can rehydrate your spinal discs by just doing normal exercise. Okay, before I get to why you're actually having injuries all the time, and I promise I'm getting there, I just want to give you a couple of really reassuring and amazing facts about the human body. Okay, so if you have something going on, you're like, oh, well, I have a meniscal tear. Oh, I have a disc herniation. Oh, I have a rotator cuff tear. Okay, I get it. That's, would it be better not to have a disc herniation? Sure. Totally. I would rather not have one than have one. But if you have one, it's not a death sentence. Guess what? Here are some amazing facts about the human body. Did you know that most ACL tears of the ACL ligament, big injury, big deal, really important ligament. Guess what? Most of them spontaneously heal themselves. They reattach and they heal themselves. How mind-blowing is that? Okay, what about your low back? Disc herniations. Did you know? So we actually grade these things, right? So like you've got like disc bulges and disc herniations, and then you've got disc sequestrations and disc protrusions, right? Which are way, way worse than a disc herniation. Did you know that the worse that disc protrudes into the spinal canal, the more likely it is to completely heal itself within 6 months? Did you know that 2/3 of disc herniations spontaneously resorb? They completely heal themselves within 6 months. Again, how freaking cool is that? So if you thought, oh, my body is just bad, I have a bad shoulder, bad back, bad knee. No, you have a bad attitude. And probably the thing that you saw on an MRI at some point, you might not even have that thing going on anymore. But if you do, it's still okay. Most people have those and they don't even have any pain. So stop body shaming yourself. Okay. I promised you I'm gonna tell you why you are probably having these recurring injuries. And it's really, really simple, but nobody wants to hear this. The real truth is that most people that come, at least my experience when I see people clinically, the real reason that they keep getting injured is that they're not patient, right? Their training volume is all over the place and they take some time off and then they try to jump back into their activity level at the same level as before they took a break. But they just needed to ramp slowly back up into it, right? Or maybe you just got the bug to go get to go get fit again, right? Okay, so let's go get fit again, and then you jump back into your college days. The last time you freaking worked out was in college when you were maybe a college athlete, right? But you haven't worked out for a long time. And now you have this weekend warrior syndrome where you work a desk job 9 to 5 every day of the week. And then on the weekends, you go try to climb a 14er mountain. You go try to, play kickball and lift weights. You do all this stuff that your body just isn't used to. So the real reason that people get injured, recurring injuries all the time, is that they are not patient and they are not diligent about being, okay, Here, we're gonna just do a little bit of exercise. We're gonna test it. Just a little bit. Yeah, I know it's frustrating. You wanna do so much more, but just test it, be patient. Try this amount of exercise. And then after you've tested that for like a week or two, let's try to add a little bit more. Don't skip steps. Don't go from A to Z. Go to A and then B and then C and then D and then E and then F, and very slowly increase. As a general rule, we want to see about a 10% increase per week. No more than that. So if you exceed that, if you go and you put 100 pounds on the bar and you do a bench press, and then the next week you try 150 pounds, holy crap, that was a 50% increase. That's a huge increase from week to week. So just be patient. You're gonna be okay, but you've gotta have patience and you've gotta be consistent with that patience, okay? Because if you take a week completely off, then you come back to the same level of training that you just had, your body needed some time to ease back into it. So the biggest reason that people come back and they keep getting injured is they are not consistent with their training, where they're really, really good about doing the same stuff repeatedly and not adding too much more intensity per week, right? So weekend warrior syndrome, inconsistency, and a lack of patience. I know that sucks. It's not a quick fix. You can't just roll it out, but that's the truth. But here's the cool thing, is that means that you can ignore all the noise of people who are telling you your body sucks, your mobility sucks, you've got to get more hip internal rotation, otherwise you're going to keep jacking up your back. All that stuff, you can just ignore that. It's not true. Yes, sometimes you can have a better time. You can have a better experience of weightlifting or a better experience of exercise if you work on some targeted mobility and some targeted corrective exercise. But by and large, the big picture here is that you should be spending more of your time focusing on consistency and patience and how you manage your training volume. That is a way, way, way bigger impact than form, mobility, specific exercise selection, et cetera, et cetera, et cetera, okay? Those things sometimes matter for some people, but they matter way less, way, way less than just generally being patient and consistent. If you have questions, leave them in the comments. Thank you for watching. I'll see you in another video. And remember that motion is lotion, so move your body every single day.